Hi, everyone. Thanks for joining us for today's CareConnect conversation. Today, we are going to be talking about chiropractic care at Kelsey Seybold, and specifically asking Dr. Atkins and Dr. Turner, who are joining us today, lots of questions about their practice at Kelsey, what it's like being a chiropractor, how they treat patients, and anything and everything in between. So if this is your first time joining us for a CareConnect Convo, welcome. Thank you. We're so happy that you are tuning in to join us today via Zoom. And if you have not joined us before, just keep in mind that we are all on this together. So if you're home, we may hear your background noise or anything like that. So if you could just make sure that your microphones and your cameras are off. That way our conversations with Dr. Atkins and Dr. Turner don't get interrupted. That would be awesome. And in just a moment, we're going to be going live on Facebook as well. So we'll give everyone just a second to tune in before we get started. And sometimes it takes just a second for Zoom to load on computers. Mine was a little slow today. As you can see, Dr. Turner is not in the office. We were having Wi-Fi connectivity issues in the clinic, so she hopped outside really quick to the parking lot. So she's joining us from outside today as well. So again, thanks for joining us. And I think we have quite a few people joining us, and our stream is live now. So we're going to start with a little bit of an introduction today. So Dr. Atkins and Dr. Turner, thank you again for taking time out of your day with patients to join us for our CareConnect Convo. And we'll start with Dr. Atkins. Dr. Atkins, can you tell us how long you've been with Kelsey and a little bit about your practice with as a chiropractor with Kelsey?
Yes, so as she mentioned, my name is Dr. Atkins. I've actually been with Kelsey 1 year today. And my practice here, mostly I tend to focus on just general pain with the neck, the back, those types of things, headaches. I also see pregnant patients as well. Basically, I'm just here to help with overall health, and then those who are experiencing pains through the work, stiffness, tightness, and those types of things.
And so Dr. Turner, how long have you been with Kelsey?
I'm approaching my almost 5th year here now. It will be in October, 5 years for me. And I have loved every second, every minute of it. And as far as my practice goes, because I've been here so long, I see a ton of maintenance patients. And being with COVID and being away for 3 months, I think everybody is really recognizing how important to stay balanced and aligned and keeping on the up and up when they're out doing their things, and how much it is important that they come in for their routine treatments as well. As Dr. Atkins says, we do treat those pain patients too, but it's not the necessity of our practice. We treat everything from just that stiffness and that tightness to the pregnant patients that got a little in their lower back because of the way that the gravity has changed because of the baby. So it's absolutely fantastic, and we see a wide variety of patients.
Great. So we're going to start our questions today. If you have a question for Dr. Turner or Dr. Atkins, we highly encourage you to ask them. If you're tuning in via Facebook, you can comment on the live stream on Facebook. And if you're on Zoom, there's a little Q&A box in the bottom. You can submit your questions there as well. We'll try our best to get all of your questions answered in the time that we have with Dr. Atkins and Dr. Turner today. If we don't have time to get to your questions, we'll be sure to post a follow-up with an answer to your question as well. So we're going to jump right in. So Dr. Turner, you mentioned that you treat patients for pain as well as regular balancing and keeping in line during your daily grind of life. So what specific type of pain can chiropractors treat and not treat for that matter?
Well, pretty much we can treat everything, and we've got a vast knowledge in our diagnostic capabilities that if it's not something that we are comfortable treating or can treat within our scope of practice, that we can always refer out to those doctors that can. Generally, I mean, anything can be evaluated by a chiropractor as long as you haven't lost any bowel or bladder control, or things are super swollen on one side and not the other, or one arm is discolored, or one foot is completely numb and tingly. We can evaluate everything, and we can refer on, or we can treat accordingly.
So Dr. Atkins, can you tell us a little bit about some signs that may indicate someone needs chiropractic care?
I think the first thing that most people notice is like a stiffness or a tightness. And typically you kind of throw it away and just say, oh, it'll get better. And typically it does the first few times. And then one day the stiffness or the tightness doesn't go away. And so when you wake up in the morning, you have to like feel yourself turning your neck, or you have to like get up slowly, because if you get up too fast, you feel like a catching sensation in your back. And so at that point, that's when people generally come to see the chiropractor, when it's at the point where they're now experiencing pain. I think the best time to come in is when you just first have that tightness or that stiffness that's bothering you.
So, Dr. Atkins, can you tell us a little bit about what is involved in an exam and an adjustment? So, if there's someone who's never been to a chiropractor, isn't very familiar with chiropractic care, what can they expect when they come to see you or Dr. Turner?
Okay, so it's real simple. So first you come in, we get a history. You let me know what's going on with you, how long you've been experiencing the pain that you have. What do you think may have caused the pain? Some people have symptoms like Dr. Turner mentioned, numbness, tingling. We just try to find out as much as we can about the pain that you have. And then at that point, we'll go ahead and do an exam that's going to focus on the issues that you're having today. So if you have a neck exam, that's where we focus our exam. If you have back pain, we focus on the back. If it's both, we do both. And then after that, once we do the exam, we like to check for reflexes in the neurological exam, just to make sure your nerves are up and running just fine. We check for pain and tender points, any stiffness, tightness, tenderness. We also do some orthopedic testing just to help us diagnose what's going on with you. At that point, typically we will go ahead with the treatment. Unless you're around 60 years old, sometimes we do send for x-rays, or if you were in a car accident or a trauma or something that would make us want to get x-rays, just to make sure that you don't have any red flags or anything that would keep us from treating you or harming you if we were to treat you. And then after we get the x-rays, we'll have you come back in. We go over the x-rays, we go over what we think is going on with you, and that's when we proceed to do the adjustment.
So, Dr. Turner, we had a question that came in that said someone's interested in seeing a chiropractor, but they're very anxious about the process of having an adjustment done. So can you tell us a little bit about the process of doing an adjustment, what's involved, and specifically they wanted to know, does it hurt when you receive an adjustment?
These are questions that we field all the time, and we do get a lot of nervous Nellies when they come in, and it's very, very normal. I'll kind of give you guys, the first time that I had an adjustment, I didn't know what to do, and it was by my uncle. So trust is a huge factor when you're allowing somebody to touch you the way that we are, and the cracks and the pops kind of scare people as well. So we've got to gain some rapport with our patients, and we've got to make them feel comfortable with what's going on, and you've got to explain to them, and we will explain it to you at least, to make sure that you understand the process of what's going to happen. Breathe in, breathe out, and you might hear some cracks and pops with a push. All right, we're not trying to shove your spine through your chest wall. That's not the point of an adjustment. Adjustment is just to move the bones so that we can get them more functional and more mobile. Generally, does it hurt? No, absolutely not. But there are some times that it does. So if you've got tissue tenderness or you've got some swelling in an area, it can be very tender. Or if you've got a hot low back or a really stoved up neck, can it hurt? Yes, but we've got different modalities that we can use to undo some of that stuff before we even get in there and start actually applying a manual adjustment.
Can you tell us a little bit about the different modalities that you use? We had a question that came in about that. Do you use spinal decompression, laser heat, exercise, stretching, anything else?
In our offices, we are just hands-on adjusters. We do the activator treatment too, and that's tool assisted. So you don't hear the cracks and the pops when you get that. We also do some flexion distraction, which is not decompression. It's just a different avenue to open up the lower back and create more motion in through the lumbar segment. We do acupuncture as well. I am trained, and Dr. Atkins I know is about to. But as far as like the other modalities, or what we call passive modalities, we don't do here in office. That would be things like your electrical stimulation, or the intersegmental traction, or the roller table is what collectively we get told it is called. But we do, and we do show you guys how to do stretches and strengthening exercises, because it really does help us help you and get you better faster.
So Dr. Adkins, we're going to hop back over to you for a second.
Okay.
If you have an adjustment, will it completely get rid of your back pain, after your first adjustment, or is this an ongoing process that needs to be coupled with stretching and exercising at home as well?
So typically what I say is, for everyone is different. Everybody's pain is different. I've had patients come in, get adjusted one time and feel great after. Some people, it takes longer too. And what I like to tell people to keep in mind is that this pain didn't happen overnight. Usually it's been a buildup from playing sports and car accidents and sitting at your computer all day at work for however long you've been there, or whatever the case may be. So usually it takes time for this to even happen to you, for you to have that pain. And so typically we put each patient on a treatment plan according to their symptoms, whatever that we feel that they may need. We put them on that treatment plan, and then we assess their pain as they go along the treatment plan. Some people get better within that treatment plan. Some people need longer treatment plans. As Dr. Turner said, after a while, people get better, and then they just choose to come in ever so often, just to get aligned to make sure that the pain doesn't come back. Some people we have to refer out to different avenues just in case the chiropractic treatment doesn't work for them.
So we do have another question that came in about treatment. Is it appropriate for pediatric patients to see a chiropractor as well?
Oh, so yes, we can see pediatric patients, but we do need a referral from their primary care doctor.
Oh. So Dr. Atkins, do you have any other tips or anything you would want to share about working from home? Any stretches or exercises that you personally like to do yourself?
Okay, so sorry if I'm repeating anything Dr. Turner said, I couldn't hear. But yes, typically, so we do recommend stretching and exercises, especially for the neck and the lower back. Me and Dr. Turner actually just made a video together with some stretches and exercises that the patients can do. And also in clinic, we give them printouts of stretches and exercises as well that they can start to work on. And then in terms of like just when you're at home working, the best thing that I think is to make sure that you set your home office up as you would at work. So you want to make sure that you're sitting at a table as much as you can, or not being in bed trying to work. Sitting at a table with a chair with a good back support, a lumbar support, making sure that you're sitting up straight, shoulders down and back, making sure that your back is against the chair. Usually we start to sit forward in the chair or at the front of the chair, and we start to notice ourselves slouching throughout the day. And so that's when we start to get a lot of that back and upper back pain and neck pain. Also, if you need to have a lumbar pillow or something you can put in the small of your back just to relieve some of that pressure on your lower back. And just sitting with your feet flat on the floor, trying not to cross the legs or sit with your legs up in a chair, or different things like that we typically do at home when we're more comfortable.
So Dr. Turner, I think we might have lost your audio for a second. We did have a question that came in about knees. Can you help treat knee pain as well?
Can you hear me?
Yes, we can now.
Okay. All right. So yes and no. It all depends on what's going on with the knees. Chiropractic for me hasn't been as good as what the acupuncture has. So I've actually had more success treating with acupuncture than I have with chiropractic treatment. But I mean, that would be something that we would have to evaluate when the patient came in.
Perfect. Thank you. So we're going to hop back over to Dr. Atkins again. We talked a little bit about pregnancy in the beginning, and both of you mentioned that you treat pregnant patients. So can you talk about what an exam or an adjustment looks like for a pregnant patient and how you can help pregnant patients through each stage of their pregnancy?
So typically, first off, you want to have a referral from your OB just to make sure that it is okay for you to be treated, because commonly most pregnant women have pain in the lower back. You know, as we prepare to have babies, the ligaments start to get a little bit more relaxed. And so then you start to experience some pain in the lower back. And so the exam will be pretty similar to what we do you know, with our other patients, except we do have a pillow that actually has a cutout for the stomach. That way the mommy can be very comfortable while laying, anytime she has to lay face down. Adjustments are, you know, it depends on the stage of the pregnancy that the patient is in. Some patients, usually when they're in the smaller stage, I would adjust them normally using the pillow as needed. Typically, when we get closer to having a baby, we do more of activator adjustments and those types of things.
Can you explain what an activator is, just so everyone who's tuning in knows what you're referring to?
Yes. So it's a small little a tool, and basically it sounds like a staple gun or a clicker. And so what you do is I just put it on a joint that I want to adjust, and then I'll tap it, and then it pushes that joint into some motion. Very gentle. It's not only used on pregnant patients, we also use it on older patients who are unable to tolerate high velocity adjustments.
Perfect. So I think we're wrapping up our conversation today. We did have two more questions that came in. One of them was regarding your experience for both of you as chiropractors. So how long have you been chiropractors?
Do you want to start, Dr. Turner?
I'm approaching 15 years now, and it has been fantastic. And I truly believe with what we do and how we change people's lives, and how it can completely change not only my patients but myself as well. I get to go to work every day and enjoy my job and see things so little change so big.
So Dr. Atkins, how about you?
So I've actually been practicing a year. So thankfully, I've had the help of Dr. Turner to make sure I'm doing everything okay. But no, I same as her. Like, I love it. I feel like, you know, when I first got into this profession, I didn't even know what a chiropractor was. When I decided to go to chiropractic school, I learned about it once I was in school and fell in love with it. Realized that, you know, this is definitely an avenue that people should start to looking into, especially if you don't want to go the drug route or if you don't want to go the surgery route. Definitely, we have helped people get better, people who've had pain for years, people who are unable to play with their grandkids or go garden in their yards, or, you know, whatever the case may be, being able to have some change and allow them to live their life how they used to before experiencing that pain. It's been a blessing.
So Dr. Atkins, can you tell us a little bit about where chiropractic services are available at Kelsey, which locations? We had a question that came in about that. I know it's available on our website as well for everyone to reference, so you can go to kelsey-seybold.com to find it. But can you tell everyone where you and Dr. Turner practice?
Yes, so me and Dr. Turner go to the four same clinics, main campus. We also go to Pasadena, Pearland, and the Tanglewood locations.
Perfect, thank you. And Dr. Turner, if someone wanted to schedule a chiropractic appointment with Kelsey Seybold to see you or Dr. Atkins, how would they go about doing that?
Well, you have one of three choices, or two choices, I guess. You can go online and do it via the My Kelsey Online app. You'll find us under specialists, and you'll find us under chiropractic services. And if you guys call in to the call center or the contact center, you are more than welcome to do it that way too.
Perfect. So if you didn't hear Dr. Turner, you can call the call center, which is 713-442-0000 to schedule an appointment, or you can hop online and do it as well. We're going to go ahead and wrap up our conversation today. So thank you, Dr. Atkins and Dr. Turner, for taking time out of your day and joining us for our CareConnect Convo online. Be sure to tune in. We'll have another conversation coming up next week as well. So I hope everyone has a wonderful day, and thank you again for tuning in.
Thanks for having us.
Bye,
Thanks,
guys.
Lane. Thanks for having us. Bye.